day out, and they do a great job, and they love their job, and they enjoy what they do. We're here tonight to talk about COVID. Our governor is really wanting to get our state back to work, and he wants to hear from all of you. So it is my pleasure and my honor to introduce Asa Hutchinson, the governor of the state of Arkansas. Asa.
Thank you. Thank you, Mayor, and thank each of you. Please be seated. And I'm just so grateful that you came out tonight. There's a lot of things going on. I know the mayor's got a town hall meeting he has to go to tonight, but we've got mayors from surrounding cities here in Lonoke County. We've got educators that are here, teachers that ready to go back to school and want to make sure everything's in order. We've got those that are just interested in health and good citizens here, and we might, who knows, have some people that, you know, want to raise some questions, and that's really why we're here. We're trying to, you know, we can't address COVID at this point from the top down. We've got to really engage and listen to our communities and build confidence and build acceptance in what we're trying to do and what we need to do as a community. And so I hope we can have an honest conversation. I've billed these as community COVID conversations. And as was stated, our first one's in Cabot. Why did I pick Cabot? Because you've got great leadership here, but it's really broader to Lonoke County in this area. And while Cabot is maybe not considered an urban area, it is a metropolis. It has a good population base here, but we also in Lonoke County represent the rural areas of our state. And it's really the rural areas of our state that have struggled in terms of vaccines. And let me just, what I want to do is I'm going to talk for just a little bit and go through some statistics that worry me. And then we're going to set the stage and turn it open for questions or comments that you might have. And we want to be able to listen to you, learn from you. We do have Dr. Romero here from the Department of Health, who's been a good partner in this. And I have to have some expertise in addition to my political lens and my leadership role as governor. Over the past month, we have seen a significant increase in the number of COVID cases, active cases, and hospitalizations. And let me just strike the tone for us tonight. On June 7th, and June 7th was not that long ago, right? June 7th, Arkansas had 1,594 active cases. Yesterday, only 1 month later, we had over 5,000. On June 7th, we had the total of new cases that day was 62 new cases. Yesterday, only 1 month later, we had 1,000. And regrettably today, they went up another 21%. So we had over 1,200 new cases today. 1 month ago, we had 62. On June 7th of this year, 175 Arkansans were in the hospital because of COVID. Yesterday, one short month later, 432 were hospitalized. And yesterday, we had an increase of 55, I believe it was. And then today, we have an additional large increase. There are two explanations for these increases that we're seeing. First of all, the Delta variant. And the Delta variant I'll talk about in a minute, and the other one is the low vaccination rate. The Delta variant was first identified in December in India and is spreading rapidly, and they renamed it called the Delta variant. The CDC estimates that the Delta variant accounts for more than 1 in 4 new cases in the United States. And I think that's actually old data. When I have my White House call, they talk in larger numbers in terms of the percent of cases that are Delta variant. The Delta variant is more contagious and more easily transmittable than the original. And people who catch the Delta variant are twice as likely to go into the hospital than those who caught the original. And so you can see the impact of that one variant that has a more virulent strain And people who are not fully vaccinated, let me underscore that, fully vaccinated, are not safe from the Delta variant. Even those who had COVID should be vaccinated against the Delta variant. Now let's talk about the low rate of vaccinations, which is below the national average. And I usually just sort of hide, I don't like to talk about things where we're below the national average, but you know, we got to be honest about this. And the fact is that as of yesterday, only 39% of Arkansans 12 and older had been fully vaccinated. Now that's 12 and older, which is the eligible population for vaccinations. Nationally, again, 39% in Arkansas. Nationally, that is 56% that have been vaccinated. So we are significantly below the national rate of vaccinations. And if you look at the 18 and plus, and you got to be careful whenever they start throwing out percents, because are you talking about the whole population, or are you talking about 18 plus or 12 plus? So I'm trying to be straightforward here. If you look at just simply the 18 plus population, the United States percent fully vaccinated is 58.5%. That's the average across the United States. Arkansas is 43.7%. Now, I like to always compare us. Vermont, 76% vaccinated. Massachusetts, 73% vaccinated. New Mexico, it's a rural state. They got a lot of Indian reservations there that might make a little difference. It's 67.8%. They have a pretty high rate of vaccination. Again, Arkansas is 43.7%. Now, just so we're sort of balanced in this, though, I looked at just right before coming here on the New York Times website, the CDC numbers, who's below us. And Idaho's below us in vaccination rate. Tennessee, Alabama, Wyoming, Louisiana, and Mississippi are all below us. Now, what do those have in common? They're rural states, and most of them are southern states, and they have low vaccination rates. Now, what I worry about for them, just like we have right now, Missouri is having the Delta variant. In fact, I think we got a lot of it from there, and it's hit us hard. And you're seeing our cases go up, our hospitalizations go up. I think any state that has a low rate of vaccination and the Delta variant moving in, they're going to have some tough experiences ahead for them. And so, obviously, we want to get ahead of the curve. Here in Lonoke County, we have 36% of the entire population is fully vaccinated. Now, I have to say, let's go back to what's easier to compare. The 18 and plus, what did I say it was? Yeah, 58% of the U.S. population is fully vaccinated. In Cabot, 68% of the population 18 and older has received at least one dose. Let's give Cabot a round of applause there, actually. Now, that's one dose, and so finish the job, because one dose doesn't immunize you. But it is a pretty good percent whenever you look at the full county. And it's 59.7% 18 and older are fully vaccinated. So this area is not bad, but if you look at the county as a whole, 40% of county residents has received at least one dose, and 36% of the full county is fully vaccinated. You see the difference between Cabot City and the rural areas of Lonoke County. And so there's a lot of relevance to the conversation that we're having here in Lonoke County. Now, that's probably enough statistics, but you might ask the question, well, what are we doing about this? Well, we've fought this battle for 18 months. We've gone through a lot of different cycles in this, and right now, you saw, a month ago, June 7th, and even before that, our cases went down to a low level. Our hospitalizations were down to a low level. And so every mandate is off in the state of Arkansas. There's no mandate that governs anybody's behavior, is anybody's business. There's no mandates. There's nothing. There's no mandates to get a vaccine. There's no mandate to wear a mask. There's no mandates on anything in relation to COVID. It is wide open in terms of our business. And why is that? Because the vaccine is out there and available. We have educated for 18 months, and everybody has the right to individual responsibility and to use their best judgment and to make good decisions. And so that's where we are in Arkansas. And so there's not a whole lot the state can do. It's all about what the community can do and realizing how important it is in the community and resident to resident making good decisions. So I'm here tonight to listen and to hopefully learn something about the community as to what more we can do. Now, right before I came here, someone forwarded me an email. And this email sort of tells the story of the challenge that we face. The email says, "Stop the mass lethal injection agenda against humanity." And it's got refusal vaccine, stop. Urgent alert, our Arkansas governor are starting the propaganda campaign called Vaccine Hesitancy in Cabot, and urges everybody to come to this. I hope they did. And then it starts having the questions that can be asked there, and it goes on that is very fascinating in terms of the objections that are raised that COVID-19 is caused by graphene oxide introduced by several ways to the body. One of them looks like mask, and in short, graphene oxide is the supposed SARS-CoV-2, the supposed new coronavirus provoked before the disease. Anyway, it goes on. Let's see. It goes on and talks about mind control in here. So anyway, I'll leave it at that. But it's pretty interesting reading, and I think it illustrates the fear that is being propagated out there and what we're facing as a state. We've got to overcome that somehow. And so let me stop, and I'm going to turn it open for questions. I would encourage everybody to be respectful. Please make a short statement or ask a question, and let's have a good conversation. I'll start out with just simply some questions. What more can we do in our community? What more can we do in our community? How can we overcome misinformation? And how do we build confidence? So let me throw that out there, and this is a listening session, so let me turn it open, and thank you all for your patience. So let me talk through some of this. Yes, sir. We got a microphone right there.
Thank you. Sharing germs. First of all, Governor Henry Hawkins, high school principal here at Cabot, I want to thank you for what you've done. You have helped us in education. We've just lost almost a full year of facial recognition with kids, and that is hard in the educational world. I wanted to just tell you thank you for what you've done. I feel like you've tried hard to get us to somewhat normalcy in a really abnormal time. I know that athletics is important to you. It is so important to our kids, and they need that. So I just want to tell you thank you. And to just touch on your questions, we've got to make sure that our patrons are educated to know that this vaccine is so effective. I think it has far exceeded expectations, and I think that the bottom line is we've got to encourage our people, our patrons, to get out there and get that done, because that's going to help us. And we're kind of going in a bad direction right now, as you illustrated, and we can't go that way. We need to go the other way. And so I just want to tell you thank you, and I think we've got to continue to educate our people and push that vaccination. Thank you, sir.
Excellent comment. Thank you. And one of the things that we wanted to keep school going, and thank all the teachers that are here, the administrators that made that happen last year. And it was successful, it was important, and now we're seeing nationally where the studies are coming out that of the loss of learning, but also some of the mental health consequences if you weren't in school and you had that vacuum in your social engagement in sports as well. So we want to have a great school year coming up, and it's going to be important to, and that's one of the reasons we're having this conversation now, because we have 30 days or 40 days before school starts, and we need to increase the percent of our population that's vaccinated before we go to school. Next. Yes, Senator Ricky Hill.
Senator, I guess one of the big issues I think we're facing is the marketing aspect of this. Getting it out there to make people want to get the vaccine. I think a great marketing aspect that we need to look at is our military personnel are asked to step forward and take this vaccine before they're deployed. And I feel like personally, living in the city of Cabot, that if we can ask our military personnel to do that, the least we can do is take the vaccine ourselves to protect them, since they're out there trying to protect us.
Hear, hear.
So marketing is one of the key words I'd like for you to use on that.
Okay, and we've got some of our marketing team here. I think that is a excellent point. We'll see if we can't weave that in, but that's just an illustration of somewhat of a patriotic duty, but also that's what we're asking of our men and women in uniform. Thank you, Rick. Yes, back in the back.
I'm a nurse practitioner here in Cabot. We met earlier. Thank you. First of all, I want to agree. I thank you for everything that you've done. I think that you've done a lot to try to help us open back up and get back to normal things, and I do appreciate that. I spend a large part of my day, not only am I seeing a lot more anxiety and depression in adolescents and adults related to COVID, but I spend a large part of my day dispelling myths, bad information, propaganda regarding this vaccine. So I agree that we have done quite a bit to educate the state in general, but what do you have available, or can you make some things available to help me in my job to let people know that this is not a dangerous thing? There are no microchips in them. It's not changing your DNA. You know, all of those things that I answer on a daily basis, multiple times a day.
Excellent question, and you know, I think one, the Department of Health has a lot of good information. The Department of Health website I'm referring to, they have all the data, but do you dispel some of the myths on there?
We do, and we have links to the CDC's excellent presentations that dispel that. We can provide videos and things like that.
Yeah, so make sure, Dr. Romero here, you connect if there's some specific information, but there's great stuff on the CDC website, as he's saying. They already have done this from a national standpoint, checking out you know, some of the myths and dispelling those. We have the data there. But you know, the key thing to me is who are the trusted sources, and nurse practitioners, medical professionals, doctors and clinics. That's where people go to when they're sick, because you trust them and they know they have information that's helpful and they've been trained. That's where I want people who have questions to go, is to go to your medical professional who you trust and ask all of those questions that you might see on the internet, and don't just simply accept them. Thank you for that point. All right, so here, and then we'll come over here to the left. Yes, ma'am.
The question that I have is, you had mentioned with your statistics the number of people who had COVID. There was a tremendous increase between last month and this month. Is there any way you could break those numbers down to say this was the number of unvaccinated people who got COVID versus the people who were vaccinated that got COVID? That would be something, a number that I would be interested in.
Absolutely, and we have that information. Dr. Romero, do you have that? Are you prepared to share it?
I can give some of that information.
Why don't you come up right here with the microphone? This is Dr. Jose Romero.
So let me give you the data for some of the really high impact issues. So of those individuals that have been hospitalized, 90% have not received the vaccine. Right? For those individuals that have succumbed, that have died from the vaccine, over 95% have not had the vaccine. So it's clear that the vaccine is preventing serious consequences. And we know that the vaccine, some of you may get infected even if you have the vaccine, but the important part about that vaccine is that it prevents me from becoming hospitalized and from dying. And that's what I look at as a physician, as somebody who wants to prevent disease. So we have that information. We can get even more granular than that if you want us to.
Perfect question. Thank you. And right over here. Yes, sir.
My question was much in line with hers, talking about the marketing and breaking these numbers down. You talked about 1,500 a month ago, 5,000 now. Out of that, what are the demographics? What's the age groups? What, you know, and that needs to be publicized more so that we know what demographics need to get the shots the most. I mean, I'm over the 39 age group, obviously.
Barely.
So I was in one of those early groups to get my shots. And I got them because of all that was being said about the death rates and et cetera. Of course, then you get real suspicious of some of those death rates because you see people that you know that were in hospice for something else, but they had COVID and they died of COVID. Well, they would have died 2 months earlier or later anyway. So, you know, those numbers get skewed, and that kind of information costs a lot of doubts. So somebody that's 48, now I've got some stepsons that's in the 40 age group that are real hesitant to take the shots. And we're concerned about them. We want them to take the shots. But why? I mean, you know, we need, I mean, if there's nobody 48 years old getting sick, why would they take the shot?
Listen, beautiful question. And first, you don't have to share, but is there any reason that people would give not to get the vaccination?
Well, they just,
Putting it off?
yeah, they fear the shot itself.
Okay. All right. So first, you ask about the statistics on on hospitalizations and on deaths. On both those categories, and you can sort of go back and you could play my Tuesday news conference this week, but those that are 65 and plus, they ran in there and they got vaccinated because they were scared. That was the age group that was the most vulnerable. So their vaccination rate is, I think it's over 65%. So that's a high vaccination rate. And so when that happened, they stopped going to the hospital to the largest extent. It reduced their hospitalization. It reduced any deaths in that category, many of the deaths in that category. And so if you look since then, though, those that are under 65 in the 20 to 65 range, they have not gotten vaccinated at the same rate as those that are older. They have resisted it. They've put it off. And so the result is those that are going to the hospital now, the average age has gone down 10 years in about the last month or 2 months. Gone down since we got the vaccination out. It's gone down 10 years in hospitalizations and deaths simply because the older group got vaccinated. So we're seeing those that are 25 to 55 actually getting COVID and going to hospital much quicker. Do you have a comment on that?
Just add a little bit more to that. So the deaths that we are seeing, right, are really now being seen in that group under 65, under 60 years of age.
Where in the past, that group that older group made up the majority of those deaths. And I'm sorry, sir?
You don't hear that.
Well, but the governor has said that, and you know, we will stress that more and more on our website. It is the young, healthy individual that is now winding up in the hospital or dying from this disease. And this is because exactly what the governor was talking about. We have a new bandit in town, right? We have a new virus. This virus is very different from the original parental, what we would call the original parental strain. This is now mutated, changed to now have better transmissibility and causes more disease.
All right, so back to a point that you didn't raise, but I wanted to address. You know, whenever you look at the vaccines that are out there, you heard them say, great news, this vaccine's going to be, 85% effective, or it's going to be a 90% effective rate. And they were thrilled with that in terms of the efficacy of the vaccine, its effectiveness. But if you have a 90% effective rate, that means 10%, 1 out of 10, could still get the virus even though they've been vaccinated. And so it does happen, but even though, and that's important to know, because you'll hear of people, well, they got vaccinated and still got the virus. And it could be that they didn't get the second shot, or it could be that they're that 1 out of 10 statistic. But whenever you get the vaccine, even though you might have the virus, your chances of going to the hospital are significantly reduced, and your chance of dying is almost nil. And so there's even a benefit, even if you did get that virus, if you have the vaccine. All right, good stuff. Yes, ma'am.
I'm Darlene Bird. I'm a nurse practitioner also, and the current chair of the Lonoke County Republican Committee. And so I join with the principal to welcome you to Cabot and thank you for doing this. I have a couple of questions and a recommendation, if I may. I was fortunate to be in some of the early groups to get the vaccine because I'm a healthcare provider. And as we have now gone 8-9 months out, that is about what I remember hearing that the effectiveness of the vaccines were. Is there any studies, Dr. Romero, that you know of that shows the decline of the effectiveness the further out from the administration of the vaccine? And is there any talk about needing a booster, especially for our healthcare providers? I know that UAMS in our recent message from the chancellor, we had over 50 people, 50 of frontline employees out on quarantine due to this rise of COVID. So that's my questions in regard to that. And my recommendation is, I know that Representative Mayberry and Senator Hammer introduced a bill, and I believe that you signed, No One Left Alone for the hospitals. I'm not sure exactly how that applies to COVID patients, but if we can teach and learn how to don and doff PPE for our healthcare providers, we can teach family members to don and doff PPE to be with their family members in the last days of their life. No one should have to watch their parent die via Facebook.
I agree 100% with you. Your heart is right on point. I did sign that legislation. That is very, very important, and that's one of the things that I think we've all seen as to how important that personal presence is. You just have to have that. So thank you for raising that, and I agree with that recommendation. And then the first question, though, was, I can't remember. Dr. Romero can, though. Yeah, go ahead, Dr. Romero.
Thank you for those questions, and they're right on.
Yes.
What do we know about the duration of immunity as of now? It keeps getting longer and longer. So recent data presented at the CDC shows that the vaccine, it maintains adequate levels of antibody for at least 8 months after the initial administration of the 2 doses. Now that's 2 months longer than was 2 months ago. We continue to follow, so it continues to protect you. The vaccines that are currently available today, that is the Moderna and the Pfizer-BioNTech vaccines, they are effective in preventing severe disease from this new variant. So we know that works. That's data that has recently been published in the last 48 hours, right? And we're going to learn more about the Janssen vaccine, the Johnson & Johnson vaccine, as more and more people use it and goes further out. You also had a question about, there was a third portion to booster dose. Yes, ma'am. So we have discussed booster doses at the CDC. If I may, just to let you know my role in that organization, I am the chair, or was the chair, of the ACIP. That's the committee that after the FDA approves a vaccine, that's the committee that determines how to use the vaccine in the United States. We looked at the data that we have, and we looked now that at this point, there is no firm recommendation for a booster, but all of the companies have vaccines in the pipeline that are being shown to be very effective for boosting immunity to the newer strains, the newer viruses. So I don't think you're going to need to be boosted for the old original. You may need to get another shot to give you better immunity against the variants that are coming up, but right now you're okay for the Delta variant.
Thank you. Thank you. More. Yes, ma'am.
And I was wondering, Dr. Romero, if you could speak to the difference or how long natural immunity versus someone having had the COVID virus versus the manufactured immunity that I have from my vaccine, the timeline as far as that goes.
I'm sorry, Governor, they seem to be taking a lot of questions. So yes, I can address that. So we know that there is at least 6 months of, and I wouldn't call it complete immunity, but immunity, yeah, after having the infection. But that immunity, at least 6 months, okay? But that in itself is not sufficient to protect you against the Delta variant. So we're recommending that anyone who had the infection previously, who's been confirmed to have that infection, get the vaccine, because that will boost their antibodies and will stimulate their immune system to recognize it. So you do have some protection, but it's not what you want. You want to have the full protection, and for that we recommend that anybody who has not gotten a vaccine, even if they've had the COVID infection in the past, receive the vaccine.
I'm going to get an honorary doctor degree when this pandemic is over. Did I see a hand over here somewhere? Yes. And then we'll go back to there.
Good evening, Governor Hutchinson. Jason Crumbler, Cabot High School, class of 2020. A lot of my friends are coming into situations as the vaccine age to get the vaccine decreases. They're coming into situations where their parents just will not let them get the vaccine. So what is your advice to those parents out there that are hesitant? And how do you recommend that those children that want to get the vaccine but may not be able to get themselves to the vaccine location really have that conversation with their parents that I want to get vaccinated despite their hesitancy?
Yeah, and how old are these? These would be 12 plus.
Yes.
I think the hats off the kid. And you know, we've actually seen some of that where usually it's the children or the youngster that does their own research and they think it through and they make a decision, and you know, they will go to their parent and make the case, and usually the parent will say, that's your decision, you go right ahead. But if they're resistant, if the parent refuses to give that consent, then Dr. Romero, do you have any comment on that? Boy, this is why he's here. That's a really good question.
No, it's an excellent question. So let me say that you know, we are a very progressive state. You know, we allow individuals like you and young and down to 12 years of age receive routine vaccinations because those are FDA approved and they're licensed, right? They're not like the COVID vaccines, which are EUA approved. So that's why there's that consent requirement. I think that what you can do, what you should do is continue to try to educate your parents, because that's what you're doing. you're educating them. And really, we need that consent form in order to administer the vaccine. But you're not the only person that I've heard this from, that adolescents are concerned that they're not being able to take the vaccine.
So if we get FDA final approval,
I think that, again, we would discuss this as we did
Yeah.
originally, but
we'll have a conversation.
yeah,
All right.
but my recommendation would be, there's no reason why it shouldn't be like our other vaccines. If you want the HPV vaccine, the anti-cancer vaccine, you can walk into your doctor's office and ask for it.
All right, let's go back here. Yes, ma'am.
Hello, my name is Sarah Brown. I'm the director of the Chamber of Commerce here in town. Again, appreciate you coming out and starting out here and being a part. We got a lot of local businesses here represented along with the educators. Cabot's got a lot of great employees here. A couple of questions that I've got though as far as our businesses. Some of the things that I've kind of heard amongst our businesses are there some more opportunities that the state is coming up with as far as incentivizing our businesses to help their employees get the vaccine, or just in general help the employees feel better about going back to work? One of the questions that I've gotten is I have an employer that came and said that they have an employee that is not wanting to return to work, has been working from home, which has been a great option for a time period. But as we're trying to get everybody back to work, some of these employees now have anxiety over coming back to work and are talking about filing disability and different options like that. And so is there a better way or a different way that you guys as the state might be brainstorming as far as how can we get our employees back engaged, support our businesses? And the PPP loans and the small business loans were phenomenal. They helped a lot of people stay open, but it's just educating. I think a lot of this falls back on education, but is there any kind of incentive that's being talked about for the business? I know you've got the lottery tickets, you got the Game and Fish tickets for the individuals, but for the business to encourage to make this thing happen too?
That's a super question, and I'm glad we have some members of the General Assembly here because they got to sign off on any new initiative or program that would involve some of our federal funding that comes in. And we do have American Rescue Plan funds, so we've got a lot of money that we can use for incentive programs, and they're fairly flexible. I think we can use it for business incentives, but it's sometimes hard to administer, and it's a little bit of the challenge. And so we'll take that back, we'll look at that and see. Obviously, whenever you have a very low threshold of cases like we were down a month ago, it wasn't necessary. People were coming back, they felt comfortable coming back. All of a sudden you see the cases go up some, and they have a different attitude about it, and the context changes. And so, to me, the incentives, you were talking about incentives for a shot, for a vaccine, or are you talking about incentives to come back to work?
Both.
Yeah. Most likely the incentives that would come for a vaccine to encourage that, that's something that we might have some kind of a grant program on we can look at. In terms of coming back to work, I think we've made a pretty bold stand in Arkansas by saying we're doing away with the $300 extra compensation for staying at home. And so they're coming back, but we want to make sure they have a healthy workplace. And we might have to look at, another grant program that helps businesses to have a healthy workplace if we don't see these cases go down quickly. But again, the ultimate solution for any worker that is nervous about going back to work, get a vaccine. If you get a vaccine, you go back to work. And so that's their solution. And, and hopefully that will keep the cases down. All right. Thank you. And so we're taking notes here, aren't we? I'm taking some notes. Yeah, good. Yes, ma'am.
I'm Ashley Davis, and I'm here representing Lonoke County Safe Haven, where we serve domestic violence and sexual assault victims. A lot of those victims end up being from underserved populations, from rural areas. We've talked a lot about educating them and the things that are available online. We have a lot of clients that don't have access to online unless they're with us, and that can be sometimes for a really short time. What are your suggestions and plans for getting the most information out to them when they don't have access to the internet or to be able to watch your news briefings or something like that? What's the best way that we can do that for them?
Well, thanks for your interest in that and wanting to meet the needs of your clientele and constituents. And the answer is we probably need to get some printed material. I bet you, Dr. Romero, we don't have printed material.
Not as much as we should.
Yeah, we need to get printed material. And so if you could send us an email, Jordan Burgess is right over here. Wave, Jordan. I'm putting you out there now. She's my senior healthcare advisor in the governor's office. So if you would, we'll get your information, we'll follow up and try to get you that. Thank you. Yeah, and there might be some other questions somebody needs to follow up with Jordan on as well. All right? Yes, ma'am.
Hi, my name is Darlene Glover Weatherly, and I'm actually a school nurse here at Cabot School District. My question is, my husband owns a small business, and this past week we had a employee that was symptomatic. So they always call me first to figure out what to do, and I told her to go get tested. She went to 2 different places, or called first, and they told her that it would be a fee of $200. So I told her to call the health department, and they told her to call UAMS, and they said that they were only testing if for prior surgeries. She finally found a place to get tested, and they told her it would be $175. So she was positive, so it was a good thing she went and was tested. But then I was also thinking, when we start back to school and we have students and they're symptomatic, and we're having a hard time finding places for them to get tested that are free.
That didn't sound right at all. But, I mean, obviously, you know, whenever a provider does a test, you know, they can bill an insurance for it.
Mm-hmm.
But we've said all along that if you need tested, go get a test, and we're not going to be charging you if your insurance doesn't cover it. Now, Dr. Romero, has that changed?
No, it should not have changed, if I may add.
Yep. Yep.
So you should not be, there is an option to all of you, all of us, and that is that each county has a local health unit, and that local health unit can test. Now, I have to apologize if you were told by somebody at the health department to go to UAMS, then I need to look into that, and I'd love to hear about it so that I can not let that happen in the future. But we, the health department, will test for free, and we'll either do it on site, or we'll take the specimen from you or whoever and have it sent to our central laboratory where it can be done by PCR, and you'll have the result within 48 hours. So if you're having problems, then let us know. We can change all that. We have that well set up in here, and the governor was really a driver for that issue, that everybody be able to get this vaccine, testing for free if necessary.
All right, repeat the question. I didn't hear the question, but Dr. Romero, did you hear it?
I heard that.
Why don't you repeat the question for
So
everybody?
so the question is, why don't we set up sites in our rural counties where we can also administer the vaccine for free? Is that correct? Is that the question?
Sure, absolutely.
Right. So that they're already there, and we have every local health unit can administer the vaccine. So those are for free. We will not take any fee from you. If you have insurance, we'll copy that down. But if you walk in and you have no way of paying for it, we'll administer that. And there are different vaccines. And am I correct, Colonel? This is Colonel Ador, our director of the program. And so it's available throughout the state. There is nobody in this state that should have to pay for it if they cannot afford it.
There is a public health office in every county that will cover all of that. That's what they're there for. Now, you're right, some people don't know about them. And so you've got to look it up and make sure you tell them that we do have those local health units. And by the way, we have the Cabot or Lonoke County Health Unit outside. You might have seen them come in, and they're there, and they're available to give a vaccine. So I wanted to give them a shout out and thank them for being out there this evening.
May I add one thing, Governor? The other thing that all of you and everyone in the state should understand is that if you have an event that you need or you want to vaccinate at, please call us. We will make sure that a team goes to that site and delivers the vaccine for you, right? So just pick up the phone. We'll do it. There's no red tape. Just where and when, and we'll be there.
Okay. Yes, ma'am.
Hi. Tammy Krameyer. Currently, vaccine manufacturers have liability immunity. So what, if anything, does the state offer to Arkansans should they suffer an adverse event from the vaccine?
We don't have, I'm not aware of any plan for compensation or coverage of that. Obviously, there should be health coverage that's available because we cover low-income Arkansans if they don't have insurance. And so there should be that coverage available in terms of health care, in terms of compensation. We don't have any program that I'm aware of for that. Yes, Jose.
So the federal government has a program that has been in existence for more than 3 decades. If you are injured from a vaccine, you can apply for compensation through that program. I can't give you the numbers off the top of my head, but I can tell you that it is a fairly low bar, right? So if your doctor says that you were injured from the vaccine, you can be compensated.
Yes, ma'am.
Dr. Romero, Christy Reed, I'm a family practice physician assistant here in town. As far as the vaccine, where are we with getting this formally approved? Because one of the things I hit every day, went through it with a family member this weekend. It's experimental. It's not approved. Why should I do it if it's still experimental? And I believe it was Kim back here, and fighting that all day long. And the lady over there that wants something in print, we want it too. We don't have time to stop and pull up the phone and look up the website every day with every patient.
We will correct that. Thank you.
So Dr. Romero and I have talked about, I'm going to answer your question there because I've actually talked to the FDA administrator on that particular point as well as to the White House on it. And, the research is there. The data is there that supports that. It is in the hands of the FDA for at least one of the pharmaceutical manufacturers for final FDA approval. So we're waiting on them. You want them to do their due diligence and review the data. I don't want it to come out rushed and people say, well, they just hurried it. But at the same time, they just approved an Alzheimer drug and gave final approval, and it was a very short amount of time. So the data is there. I hope that comes quickly because that makes a difference. We're not going to do it, but other states, will, and businesses and hospitals that might want to require vaccines don't want to do it until there's beyond the emergency use authorization. So we're pushing the same way you're pushing, and hopefully that will come soon. They wouldn't give it. I tell you, the FDA just dodged all around the place when I asked them. Ricky?
Governor, I hear what everyone's saying here. And one of the biggest complaints I've always heard is it takes the FDA too long to get something approved. It takes them too long to get something approved. Now they've got something approved faster, and so we're reversing it and saying, well, this thing didn't take long enough. We've got to use some common sense when it comes to this. Do we want something fast that protects American people, or do we want to wait 5, 6 years and see what happens? So, we've got to figure out which way we want to go, and that goes back to individual choice.
Yep.
So everyone will have to make their own decision on that.
It's hard to be consistent sometimes. Let me ask a question of the audience. How many of you, I'm going to ask if you've seen one of our public service announcements or actually paid ads encouraging people to get the vaccine or something. How many of you have seen an ad? Okay. That's pretty much everybody, I think. Do y'all think we need to do more or less advertising on the vaccine? More? How many think we ought to do more advertising? I bet you what I'm hearing, though, is that the more probably should be very specific, trying to answer questions that are being raised here. And I think we have to have some really targeted messages. We'll continue to work on that. I did want to, we have some more questions, but we're going to end this about an hour. But I wanted to play one of our ads that will be coming up. You've probably seen the story of the lady who was pregnant that got COVID. And she has her story to tell. And then I also wanted to introduce Dr. Greenfield here, who is the Arkansas Section Chair for the American Congress of Obstetrics and Gynecology, which also he's at UMS, I believe. And so Dr. Greenfield, I asked him to be here tonight because I thought there might be a question on fertility, but also on a woman who's pregnant and how to deal with it if you get COVID. So, Doctor, can you talk to that just a little bit? Go ahead, Lisa.
So I'm an OBGYN. I've been at UMS on faculty for about 17 years, and I can tell you that a good indicator of a healthy community is childbirth and starting a family. I've never met a family that did not want to have a healthy pregnancy. And over the past year, what we have seen is we've gone from a period of stress and anxiety to having options. In the process of this, we've battled myths as well. Will the vaccine cause infertility in a male? Will it cause infertility in a female? And while there have been myths that are out there, the data just simply does not bear it. There is no bearing on the impact of fertility in men or women. What we have seen, however, is that the impact of COVID on pregnant women, while the absolute risk of a woman contracting COVID-19 is low, of those women who contract it, they are at an increased risk of more severe disease compared to their non-pregnant counterparts. So in reality, how this plays out is, I'm getting ready to start a family, should I get a vaccine? And the straight answer to that question is absolutely. Do what you can to protect yourself. The next question is, I'm pregnant, now what should I do? And then that's where it gets a little bit more nuanced, and I encourage everyone to have a conversation with a trusted healthcare provider. But know that you do not have to have a pregnancy test prior to receiving a vaccine. It is available for you. You do not have to go to your OBGYN or your obstetrics provider to get the vaccine. And when you're going through the conversation, you want to assess, what are the risks and the benefits? What we see is that when women are vaccinated, there's no evidence that the vaccine causes harm to the mother or to the baby. Okay? Now, women were not included in the original vaccine studies, and so the data is still coming forth, but there have been thousands of women who have received the vaccine and discovered that they were pregnant. There have been thousands of women who have subsequently been pregnant and received the vaccine going forward. So the data is simply encouraging, and as the theme is shown, the more we know, the more we will feel better about it. In reality, how the conversation goes typically in my setting is, should I be vaccinated? And we will discuss pros and cons, but I can tell you I've never entered a conversation where I did not encourage my patients to be vaccinated. And in terms of families, the husband, the wife who are bringing in a child, this is an opportunity to create a cocoon around a newborn, because the vaccine is not going to be available for the newborn up until age 12. And so if we can bring that child into a safe environment where mother, family, husband, grandparents, eligible siblings are vaccinated, that'll create the safest space. Because the reality is, what we have seen is that for the pregnant women, and I can tell you I have admitted more than my share, and I thought we were through this, and I've seen the numbers creep back up in recent weeks, as the governor has already alluded to. The threat is still real, but we do have choices of what we can do to protect ourselves and our families.
Governor. Thanks again for joining us tonight. Everyone's enjoyed listening to you. My name is Kevin Tipton, and I just wanted to congratulate you on being elected as chair of the National Governors Association today. I think that's a tremendous honor and a great opportunity for you and the state. But with that, I wanted to ask, is there a particular area of interest that you might look for or seek after with another state that has had a successful rate or more success than Arkansas might have had, that you could reach out to and participate and learn from to be able to bring that back to Arkansas and allow it to be a benefit for us?
A great question, and thank you, Kevin. I'm very honored to be selected by my colleagues for chair of the National Governors Association. I have a year responsibility, and I'll be concentrating on computer science education. But before we really get into that, we got to get through this pandemic. And the answer is I look for that every day. We love stealing ideas from each other. And in fact, I want you to know that there's a lot of people looking at the success of these COVID conversations because that's a new method that we're trying here. So I think it's been very beneficial, and perhaps some other states will learn from this as well. But yes, I'm looking for ways. The challenge is that, I mean, if you look up at the Northeast, who's been very, very successful, why have they gotten a high level of vaccination out versus southern states and more rural states? And actually, that's not fair, because you look at Maine and New Hampshire, they're fairly rural states, actually. But I think, quite frankly, it's some of the distrust that we see of government in the South that you don't see perhaps in some of those venues. And then you got a higher level of density of population, and so they fear it more. They live close to those big city areas, and they want to get vaccinated. So I'm trying to learn from them, but that's, thank you for raising that, Kevin. Okay, was there somebody else I saw? Yes, ma'am.
I've had several colleagues who send me texts off and on today. Is there an email that I can share with them to send their comments and concerns to you throughout that don't have an opportunity to come tonight?
Yes, and it's my governor's email. Can you give that to him, or what? It's what? And I think there's a general one, info at that comes to our constituent services. But it should be on the governor's website as well. If you go to the governor's website, there should be a email location there that you can send a message to us. All right, I would like to, I think we're winding down here, and I don't want to abuse your time. And by the way, Lonoke County, y'all are the best. I mean, there's some politics, seriously. There's some folks in office that do not want to have town hall meetings for various reasons. But listen, I'll have town hall meetings all year long with this kind of respect, with this kind of conversation, with these ideas that you presented. And so thank you very much. And can we play that ad now? And we might need to dim the lights. Is that a good idea there? But I think this will be coming out.
I was hesitant to get the COVID-19 vaccine because I was 30 weeks pregnant, and we were probably both skeptics of it.
We lived in a small rural town, and we were very reclusive because of pregnancy and COVID-19 going around.
I started getting very, very sick.
We went from sinus problems to life support in 10 days, and it was all so fast.
We were both terrified. I needed to have an emergency C-section. Not only was I on life support and had a very slim chance of surviving, I also have scars to prove, you know, this illness doesn't discriminate. It affects everyone, and it can be deadly. I almost died from it.
I got vaccinated the day that my daughter was born because the doctor said that would be the best thing that I could do for her health and mine.
My thoughts have definitely changed on the vaccine. I do believe getting vaccinated is the safest thing to do for your family. It's the safest thing to do for our family. The best decision for us is to get vaccinated.
Save lives. Get your vaccination. Learn more at healthy.arkansas.gov. Isn't it terrific to see someone with the courage to go out there and say this is important for my community and my state, that they hear this message. So I'm grateful for her doing that and telling her story. With that, I'm grateful to be here. I want to thank all the members of the General Assembly that are here, that stood earlier, our mayors that are here, the citizens that are here, our educators. Thank you very much. Give yourself a round of applause. And with that, we'll be dismissed. Thank you very much.